adults. But the biggest problem would be passing it on to their parents and to the grandparents, even more so. But yes, it is a concern, and therefore thinking about bringing children into an environment where they are in close contact with each other. If one of them, or a teacher, or another provider has the illness, it certainly could give rise to the concern that they're going to pass it on in a way that you won't know that they're passing it on, because they seem to be fine.
Yeah, I think that's what we're all worried about whenever we all go out in public. Do you have any data on what the vaccination rates have, how down they are? Are you guys like doing them through the car?
Yeah, well,
tell me how you're handling that.
No, we're bringing them into the office. Okay. Because we see children for other reasons, especially little children. You're looking at development, you're looking at behavioral issues with the parents, you're looking at just general parenting concerns. So I think running out to the car and giving shots is probably not, in my way of thinking, the best way to handle the situation. I think the best way is to make it so that as much as possible the office is a safe environment for the children. And that's one of the reasons why we're only seeing one child at a time. One of the reasons why we're not really having children who are febrile or with parents that are ill coming into the office at all. So that we're trying to give parents a feeling that they can come in a safe way and not have to worry. But we are certainly seeing some parents who are reluctant to bring their children in. No question about that. We try to reassure them that this is a environment that we're being very careful with, and we do a lot of cleaning, and we're all masking and so on to try to avoid giving them the feeling that they're at risk by coming into the office. But I think that there's more to childcare in a pediatric office than there is just giving the shots, and therefore we don't feel like we want to just run out into the parking lot and start giving shots to children. I know there are some practices that are starting to do that. And, at least in our practice, we haven't found that was necessary. If it happens, I guess it happens, but we haven't.
Right.
And of course, the other thing that's going to be happening is we're soon, starting in September, going to be thinking about the flu shots. And therefore, and there's been real concern about the fact that, if children aren't immunized against the flu because people are afraid to immunize them afraid to expose them to COVID, then the flu season could become a real problem as well, because children wouldn't be getting the vaccines, and therefore they could be also passing the flu on to their parents, which seems to be actually more of a problem in the flu than it is in COVID.
And are you, we have a mix of care. We have family care, which means, they're taking care of the kids in a family setting. And then we have center settings. The recommendation in both settings is to have the adults wear masks. Do you see that as being really important to certainly contain, for prevention and containment?
Yeah, the wearing of masks has been a rather, interesting issue in terms of, first of all, the kind of mask you wear, and if you go into the stores, you see people wearing the masks and they've got their nose sticking out, for example, which is like, why bother? And one of the things we see here is trying to get a 2-year-old to wear a mask and keep it on is a very difficult thing to do. So I do think that to the extent that you can wear a mask, I think it's really going to be up to the adults to wear the masks. In addition, there's not as much indication that the mask is effective in protecting the person wearing the mask as it is it helps protect the people around the person wearing the mask a little bit more, because the breath doesn't spread as wide, and talking doesn't spread the virus as easily as it would if you're not wearing a mask. So wearing a mask is I think a very good idea. If it's just an ordinary cloth mask or a regular surgical mask, It has some ability to protect, but not nearly as much as the N95 masks, which are not as easily available. And also, if you wear glasses, for example, or you're not careful to keep it where it belongs, they're maybe better than nothing, but not a whole lot. And so mask is a two-edged sword. You don't want to think that somehow you've got a magic protection against the virus. By the same token, it's better than not wearing one at all. So
thank you. Yeah. So I want to open it up now. I maybe have more questions. Maybe I don't. I want to open it up to other folks. So I am going to unmute you all. And if you have a question, I want you to don't be shy and speak up. Alice-Ann, I'm going to keep you muted. If you want to unmute, you can. Okay. Who is this person? Mac Mom 3. Who's Mac Mom 3? Okay, well, all right. So anyone have a question?
I have a question.
Yay.
As Robin said, most of the programs are currently closed, but
yeah.
are considering reopening. Here I live in New Haven, work in Brantford with school readiness. The mayor just issued, a notice that childcare is open now, that follows CDC guidelines and state guidelines. And of course, the state actually never closed childcare as an order, as they did here in New Haven. So as they consider reopening, we can say that programs actually always follow health and safety guidelines already. That's part of their normal operating procedures. Now we have an extra layer of concern of COVID-19. Can you just go over what should be admitting procedures as families drop off kids? What procedures would you see are important for everybody to be aware of and to know the coming and going, and while kids are in with adults?
Well, sure. I mean, I think that some of the same things that you would expect to be helpful in virtually any kind of situation, which is to try to avoid close contact between adults. I would think that again, having available the materials for hand washing and distancing between adults and children are possible. Although with children, it's extremely difficult to distance. In any childcare situation in which you have very small children, for example, hand washing in between children is essential. And that would be true anytime, not just with COVID, but I think more so with COVID, that hand cleansing or washing is certainly something that should be done very frequently if you're working with children and working between children, going between one child and another. The other things that people are talking about is, face touching, being very careful not to touch your face, and also the other thing that, if you have a situation in which the children are eating in the environment, having them well separated and making sure that the food is separated between children. If the parents are bringing the food in, I would make sure that the food is separated so that one child is not passing on food to another. Another thing that I would recommend is temperature taking. I would take the temperature of the child, and also I would consider taking the temperature of the parent dropping the child off, because if the parent is febrile, that may mean that there's something going on in the household, and that could make the child a vector, which could pass on the illness to not just other children, but to other adults that are coming in contact with the child. That's something we haven't been normally doing. And it's not that easy to institute, but I think it's something that probably is going to become more and more necessary over time until we have an effective vaccine to this virus or an effective treatment, none of which we have yet. That I think it's going to be very important to consider doing. Another thing is these masks don't last forever, and therefore one should be, providing masks in such a way as to be able to get either a clean mask or a cleansed mask on a daily basis, so that you're not wearing mask day after day after day, which becomes essentially another problem, a vector of its own, to cause more spreading of the virus. So hand washing, appropriate distancing is possible, especially between the adults dropping the children off and the adults accepting the children. And with very small children, especially hand washing between like cribs, if you have like 3 or 4 or 5 month olds or 6 month olds that are in cribs, make sure that you wash hands in between dealing with one child or another. These are, I think, pretty things that are pretty obvious and are done in hospitals for the same reasons and always have been. But nonetheless, passing on between children is something that we really need to get used to.
Yeah. Just one other question on this topic. So if a child comes to the program and maybe doesn't have fever, but what other signs of illness, what other indicators of illness should?
Yeah, cough is a big one. Mucus, just runny nose. And now the children have runny noses so commonly that sort of gives you a concern, but especially with older children who are, getting their hands all over each other, a child who's got, not just cough, but runny nose and other mucus sharing issues might be someone that you really ought to be checking on, and especially finding out if there's anyone in the household who has a cough or who has a fever. So I think you're going to have to review with the parents what's going on in the household, and I do think that some of these you can take temperatures through with without having to put a thermometer in somebody's mouth, and I think getting the material to be able to do that and find out if a parent is febrile, if a child is febrile, and then keeping open the communication lines to say, is there anybody in the house who's sick? Is there another child who's sick? And there may come a point in time we have to say, well, this child is going to have to wait a couple of weeks to come back before you allow them to come back in. Otherwise you're just becoming another source of the illness.
So a good number of questions to ask every morning or every time the child is dropped off, and
right.
Checklist of what to look for, symptoms.
I think this could become a lot more cumbersome. I think just dropping off and driving off is going to be a lot more difficult. I think you're going to protect yourself and the children in your care. It's going to take a lot more time and effort than it has in the past.
Would you mind if I read my notes to you of what we're going to ask the parents when
Sure.
they come in? We're opening up June 29th. That's our plan. And our checklist is...
How old are the children in your program?
We don't have any babies. We have a 12-month-old, almost baby, 12 months old to 5-year-old.
Okay.
But the younger children are not coming yet. The parents have decided they're not going to send them, which I think is a good idea. So when they come in, we're not going to let the parents in the building. We're going to screen them right near the door.
Good.
So we have a special rug so the kids can, the child can stand there, and then we'll screen them. We're going to do the parent first with their temperature, because that way the child won't be afraid of what we're doing to them.
Right.
Because now we have new ones that we're going to go across the forehead, or we have the one that just goes away from the child,
right.
But you take the digital. So,
infrared.
Right. So I'm asking, has your child been fever-free under 99.9 for the last 3 days? Have you given your child any pain or fever-reducing medication in the last 24 hours? Does your child feel well enough to participate in all center activities? Has your child had any rash symptoms in the last 24 hours? Has anyone in your family or anyone that you've been in contact with tested positive for COVID-19 in the past 72 hours? Is there anything else you think I should add to that?
I would think about cough. The child seemed to have a chronic cough, or any rashes. There's some of these strange rashes that have started to show up,
Right.
which especially on the feet and hands, and I would ask about that, whether they have any unusual rashes.
That's really great. Can we talk about the Miss C is what we call it? Have you done a lot of? What do you know about it, doctor?
About, I'm sorry?
The Miss C, the
Kawasaki.
how the related.
Oh, the Kawasaki type illness, yeah.
Yeah.
Yeah, I haven't seen any of it. It's actually seems to be quite rare, fortunately.
Yeah.
But it's clearly a very worrisome. It's got. We're very worried about. We've not seen much of it, but we're very worried about it. It causes some very concerning symptoms, and and the problem is that the child might have very few other symptoms, and then suddenly have this odd Kawasaki type syndrome, and at this point in time, it's a question of just excluding them from exposure to other children, because clearly they've been exposed somehow, and they might not have any other symptoms except these odd, strange, rashes and the other symptoms of this Kawasaki type illness. It's like I say, I've not seen it, and we've only had a few cases that have really shown themselves in Connecticut, but it's definitely real. And Kawasaki's is a very concerning illness as well. But again, it's very rare. And it's not something we see very much at all. But I think these children are not well. They're pretty obviously not well, and these are children that you're not going to want to have in your program until this is all over with, until the symptoms are completely resolved.
Okay, thank you. That's helpful. Who else has a question? Go ahead, Jamie.
You. Mine kind of piggybacks on what Diane was asking. So for those of you that are asking these questions of kids when they come in, we all know that we have kids that are there all the time, that have, the goopy noses and the cough that just does not go away.
Right.
If we have a child that comes in and that they just have that cough has started or that nose has started running, and we do say that they can't come in, if the parent says it's allergies or it's whatever, is it okay, or are you guys planning on saying, well, they can return when they have a doctor's note saying that it is a seasonal allergy thing, or it's whatever, or are we going to say, okay, that's what it is, or go home but then come back the next day? How do we say, okay, we're going to say that it's allergies or it's just that persistent cough? Are we taking a pediatrician's word for it at that point, or are we making that determination that that's what it's going to be? At what point are we saying, okay, we'll let you in with the cough, or we're going to let you in with that drippy nose?
I certainly would want to find out what else is going on in the household, if anybody else is ill, if anybody's a healthcare worker, for example, and is exposed to this illness, you certainly might want to have them tested, to see whether or not there is in fact an indication that this is something that's going on in the household. I don't think that every child who's got a drippy nose has to be treated as if they have COVID-19. But if they have a fever and a drippy nose, or if there's people in the household with a fever and drippy nose, I think you really need to consider at least a period of time during which you wait for them to recover from the fever part of it. And if it seems to be something that's quite chronic, you might want to make sure that at least someone in the household gets tested to see if there is anybody who is acting as a vector for the rest of the household. because, obviously you don't want to expose the other children. As again, one of the problems is that the other children being exposed may not get ill, but then they could pass it on to their caretakers. And their parents and grandparents are a whole lot more risk than they are from the effects of this illness. So I would be very careful about making sure that a child who is showing symptoms is given several days before to find out whether or not they develop a fever, because fever is certainly a very common phenomenon as part of this illness. And without it, if you have a child who has sort of a chronic runny nose and nothing else, and this has been going on for a while, like you said, it could easily be allergies. But I would give it some time before I was ready to say that.
Thank you.
You're welcome.
Okay, who else? Don't be shy.
So if we have a child that has a rash, say a rash on their arm, their leg, their thigh, so is that reason to close the room for the 14 days, or would they have to test positive for COVID? What do we do?
Rashes are so common in children. I would be a little reluctant to say that suddenly, just because a child has a rash, you have to assume they have COVID. Not until you test them. But if they test negative and they have this rash, there are so many things that can cause rashes in children that don't necessarily associate themselves with contagious illnesses.
Right.
That I wouldn't automatically assume that any child with a rash has COVID or any other contagious illness. But I would certainly want to get them tested and make sure that this rash is not something that could be risky to other children. There are so many. I mean, rashes are so common in children that if you close down everybody who had a rash from experiencing anything, these children would be pariahs for the rest of their lives. I mean, it's not fair.
But we usually know, the normal rashes. And then if we have a child that has a rash, we usually send a picture to our nurse or our doctor to, ask them. So that's what sometimes they just get a rash and it's nothing, but
Yes.
We've seen it before.
Right. No, I would, again, I would be looking for other associated syndromes. And if it's something that seems to be chronic with this child, I'd be less concerned. But if it's something that's sort of just showing up, I would certainly consider wanting to get them tested and also
Okay.
check what's going on in the household, whether there's any other parent who either has a rash or other kind of illness that might indicate a problem.
Thank you.
Mary Diamond, you're up.
Okay, hi, how are you today? So I'm hearing a lot of concerns about children being isolated for so long and having limited exposure to outside germs.
Right.
And a lot of people asking if it's going to impact their little children's developing immune system.
Well, I think if this continued on for 2 or 3 years, yes. I mean, obviously children are going to be exposed to lots of things. I don't think a 3 to 6 month hiatus and being exposed to other things is going to, I wouldn't think is going to have that much effect on the overall exposure that they have to the world. On the other hand, if you have a child who never is in the company of any other children or any other individuals, and people overreact to the point of saying, I'm going to become a hermit, my child's never going to see anybody, I would worry about those children. The exposure to the number of things that we are exposed to on a daily basis allows our immune systems to become active enough to protect us. And if you put a child in a bubble, they're going to be at risk later on in their lives because they wouldn't have been exposed to what they need to be. But 3 to 6 months or even a year of limited exposure, I don't think is going to be enough to make me say, oh my goodness, they're going to be at risk for the rest of their lives.
Okay, good to know.
Remember, the adults around them have been exposed to all these things, and they're exposing their children all the time too. So, the number of things that our immune systems are reacting to on a daily basis is extraordinary. Everything triggers something in our immune system. But I think that that if this went on for years and children are not allowed to interact with each other for years, yeah, I would have concerns about that.
Okay, thank you. I have one other question. It's on a different topic. One of my colleagues was asking, with teachers having to wear masks, and if there's infants and toddlers in the classroom, are there any concerns about, possible increase in these young children needing speech?
That's an interesting question. I would be more, I would want to ask a speech therapist about that, because obviously learning speech in part has to do with observing the way people use their vocal apparatus. Of course, adults are not wearing, you're not wearing a mask around your children, and you're the primary source by which they learn how to speak and how to form words. I can't imagine that adults, are wearing masks 100% of the time around their children, and that they're not able to observe the way parents, speak. But if this, I'd be interested to hear what a speech therapist said about this, because I do think that that's not a silly question by any means.
No, I think it also stems from the fact that most infants a lot of times are in the program all day. So from 9 to 5, they could be in there, and then the caregiver would have a mask on, so they wouldn't be seeing them, which is a good portion of the infant's day, using their mouth and their words to form those things.
Yeah, I don't disagree with you on that. That makes sense. But by the same token, even if a child is in daycare 30 hours a week or whatever, there's an awful lot of time that they're spending with the adults in their lives that are not wearing masks. So I hope that would make up for it. But yeah, I don't think it's a silly question at all.
I think especially if you're working with letters and, things that are the lessons. I mean, you mentioned something with Mary's first question about parents' anxiety. So I'm wondering if what you're seeing, if you have any sort of professional tips and tools on how to make sure that we communicate firmly, on some of the anxieties that they have.
I wish I had a magic formula on that. I am seeing parents who are obviously extremely anxious about all this. I think anytime you have any kind of health concerns out in the world, there are people who are going to become very, very phobic about things, and I see that. We try to, give some comfort to our parents who are getting extremely phobic, and they tend to be more phobic for their children than they are for themselves. But I see people who are very phobic about it themselves and don't want to bring their children in. They're afraid to get them tested because they're afraid that they'll expose them if they're tested. I think that that's a real problem, and you just try to give them some reality test that things are not quite that dangerous. It also helps to let them know that the vast majority of these illnesses, of these COVID-related illnesses, seem to be much more mild, much less severe in children. Not zero by any close imagination, but really children have gotten away pretty much on the lower end of severity levels with this illness, and that can give people some sense of comfort that their children are not the ones who are at most risk. They're the ones, and their parents, the grandparents, are the ones at most risk. That may or may not help them, but nonetheless, if you can make sure that they realize that the children are probably going to get away much less severely than adults. But this is something that we always worry about. There's some parents are just going to be phobic about their children in other ways, which is not good for the parent and certainly not good for the child. But to the extent that you can try to give them a little reality testing, about the fact that the children are much less at risk for almost all of the concerns relating to this illness. Like, things like the Kawasaki-like illness and the other concerns like COVID toe and other things. These things are so much more rare in children, and there have been very, very small numbers of severely, affected children, to the point where, I think some of that can be comforting to parents. But you can't, when you've got a phobic parent, it's almost something which requires psychological counseling for the parent, and you may want to make them realize that their fears are, although realistic, are overblown, and therefore they need to think about getting some help for themselves, because they're not helping their children by being phobic.
Well, I'm a food allergy mom, so I totally, we're probably one of the worst, the worst examples of that. But what I have done with me and my other parents, mothers and fathers that have kids that are food allergic, is we started support groups. And
Excellent.
We have a support group for food allergy parents here at the BECC, and we also have one for young kids, and so they're able to be in an environment with other kids, and they can work through stuff, work through their worries and make worry boxes and put those away, and then go back to being normal kids and things like that. So I think, yes, providing support is key, however you look at it.
And also, I think when you about food allergies, there's more and more help coming about. So, for example, it used to be that like peanut allergic children were like, oh my God, anything terrible could happen at any moment. But we're now actually getting to the point where we can start to desensitize, peanut allergic children. Not in a perfect way, but nonetheless, we can make it so that they don't have to be quite so worried about every little thing that they might put in their mouths. So there is some help. There's some hope anyway. And
there will be some hope for the COVID, hopefully a vaccination for COVID in the next.
There's a lot of research going on worldwide, and the problem with COVID is that because of the kind of virus it is, we're not so sure how well we're going to be able to provide long-term vaccination support. Some of these viruses are ones which you can sort of have relative protection against, but whether or not we're going to have a vaccination that lasts like a measles vaccine or some other kind of vaccine for years, that's an open question, whether or not that's going to be as effective as we would hope, or whether we're just going to be able to reduce the severity of it, but nonetheless, it may continue to be a problem over time.
Who else has a question? Yeah, Judy.
I have a quick question. You were talking about masks, and so do you feel that the teachers should change their masks halfway through the day, full day, like wear it one day, go home and wash it, or disposable masks? Like, what do you feel is appropriate for that? And then at what age, because our program went to 13, like what age do you think is appropriate for them to be wearing a mask with like all the other children?
Yeah, you mean the adults wearing the mask, not the children.
And the children, if we were to do summer camp, our kids, I am licensed to age 13.
Yeah.
So I wasn't sure, like, if the older ones, like the kid counselors, or like 9-year-old, I just wasn't sure, like, the comfortability.
Yeah, some of that's going to depend on what kind of interactions you're talking about. If you're a teacher in the front of a room and you're not getting on top of other children, if you're like, 6 feet away from people, I don't think you necessarily have to constantly, 3 or 4 masks a day. I'm not sure that that's necessary. Because first of all, there's only so much effectiveness to these masks. And so there's no perfect solution. I mean, you could end up putting a plastic, shield over your face, and you could get to the point where nobody could understand what you're saying. And so, yes, there's no perfect protection. On the other hand, I think, trying to maintain appropriate distance when you're working with a child, trying not to get on top of them, hand washing and avoiding touching face for the child, and wearing a mask when you are going to be within 6 feet of anybody, I think is a beginning to help. But I don't think that the mask is a panacea. I think it's helpful. I think it reduces some percentage the ability to change to pass on the illness. But I don't think it's perfect. And you see nurses and doctors who are wearing masks all the time, nonetheless getting it through exposure of their patients. And so it's something which you hope is going to help you, but you could get phobic about this and put a mask on every 10 minutes and still not be able to be absolutely sure that it's going to be protective. I think once or twice a day wearing a mask is fine. Many of these masks can be cleaned in appropriate ways, and so you don't have to buy 100 of them for a month work, but you can hopefully get some protection anyway. But you don't want to you don't want to assume the mask is going to do, is going to make the world different. It's just going to reduce percentage-wise the ability to pass it on.
So yeah, you would recommend that the teachers just go home and wash their mask every day, and not.
There are techniques for cleaning these masks, and I'm not sure exactly what they are, but you have to go to the mask maker and see what they do. And I don't know what schools are going to do in terms of whether they're going to provide these, because this is something which might be in the purview of a school system to provide. But if I were a teacher, I would certainly be wearing a mask just as much, to protect the children from me as to protect me from the children.
Thank you. Who else? Anyone else? I had Diane.
Have you had many cases of COVID with children?
No.
Or none? None or just a few?
I've had a few children who tested positive from parents who tested positive, basically. The children are not very sick at all. But they've been, been basically kept at home for a couple of weeks and with the parents, and then went on from there. But I haven't had any children with the COVID who ended up having to go in the hospital or even the emergency room. Just tested positive.
Good. And my next question is, were they in daycare or just did they get it from their parents?
No, these were. They must have gotten it. Most likely they got it from their parents. They were not in camp. They were not in daycare. And I didn't have anybody early on when they were still in school. So they didn't get it through the school. I'm pretty sure of that.
Okay, good. That's good to know. Thank you.
You're welcome.
Hear that sigh of relief, everybody?
Doctor, I have a question about when teachers are working with infants and toddlers, and they need some cuddle time. How is there a safer procedure to do it? Is it something that should absolutely not be done, which goes against everything that we're made to do?
No, first of all, I think it might be worthwhile, if a teacher of in a daycare with small children is concerned about that. One of the things that they can certainly try to wear a good mask and so on. But the other thing is they might want to think about whether there's a way that they could get tested from time to time, so that they can feel comfortable in touching the children and cuddling the children without worrying about passing on the illness to them. I don't think there's any easy way to say, I don't want the children to be put in some sort of Skinner box. That's not the way that they should be raised, and that's not the way you should be interacting with them as providers, parents or teachers. But you know, so I think, you know, protecting, and the other thing is protecting yourself is protecting the children. The children are much less likely to get really sick from COVID than you are. Okay, so, you know, protecting yourself makes perfect sense. You're exposed to a lot of people during the day when you're working with parents and with children, and you don't always know if the children might have been exposed in a way that you didn't know, so they could expose you. So I think, in a sense, by checking yourself in some way, making sure that you're aware of any concerns that you might have that would make you want to get tested, I think that you're in a way protecting yourself, but also that gives you the opportunity to be more able to protect the children by giving them the kind of care that they need, the kind of close-up, you know, parenting or adult cuddling, whatever they need. I know the 6-month-old, you don't want to treat them at arm's length. That's the wrong thing to do. I mean, we see children, you know, obviously I have to pick up the children and play with them and, you know, deal with them all the time. We're trying not to allow people in the office who have had exposures, partly because we don't want to have to close our office. You know, if suddenly we have COVID showing up on our office, we're down for a 2-week period till everybody is completely clear. And that doesn't do us any good, and it certainly doesn't do our patients any good. So we're being very.
You bring up a good point, doctor, in that I got a phone call not too many weeks ago from my pediatrician, my longtime kids pediatrician, that said that she was laid off because it's been hard on your business. And, you know, certainly medical, we seem to think that medical providers are, you know, they're not experiencing the economic stressors that that other businesses may be because they're the first in line. But in fact, I'm sure
it's not at all true, because, I mean, since we're not allowing children who have fevers in our office for obvious reasons, you know, we can't allow them to be in the office because we're afraid it would expose other people in the office or the children to the illness. So we're having to be very, very selective who we can allow in the office. We're only having one person at a time in the office, which, you know, so we're probably cutting the number of people that come through our office in a given day for each doctor in the third. You know, so instead of seeing 20 patients in a day, I'm seeing 7. So it, you know, it's something which we're not immune to the effects of this the economic effects of this virus. But, you know, we're still trying to provide services and also trying to, you know, do phone triage and help people know what they need to do in order to protect themselves and their children. But it's a tough time. It's a tough time for everybody. And I'm not surprised to hear that there are practices that are laying off for the present until things change.
Yeah, we're heartbroken. You create these long-standing relationships with your pediatricians, and then
That's true.
And then they become part of the family, and you know, beloved. So
we treasure that. Actually, that's part of why we do this particular job.
Definitely. All right. Well, it's about 5 of. I'm going to ask for a last call on questions. Go ahead. Is that Jill?
Yeah. Hi, Jill, and I work at Westfield Community Nursery School. And so my sort of thought process and kind of trying to judge, you know, my own risk tolerance. You know, my boyfriend, long-term partner, is 60, and I have kids at home, older, that hopefully will be back in college if that is what moves forward. But, you know, I as much as obviously I'm concerned about children and how sort of all of these procedures that we're going to try to implement for everybody's safety, you know, I sort of think about, like, if we're having a child that has a problem behaviorally in the classroom, and we get some guidance in terms of how we're going to sort of approach this behavior, and we all get on the same team, and this is what we're going to do. And it seems like a really great idea until 5 minutes into a negative behavior, you realize like, oh, but what if this happens? Because this isn't really going to work. So it's like that mindset where you're going to really have to work at changing your behavior. What comes naturally to you on a daily basis seems really exhausting. And when I think of how many kids a day, we have 33 to 5-year-olds, multi-age classroom. And when I think of how many kids a day, I mean, on a daily basis, where I have blood on my shoulder, or who's splatted on the wood chips, and who's crying and sneezing in my face, and it's just a really intimate physical job. And I don't really see any other way of doing it. I mean, there's not any way to keep a crying, hurt child at arm's length. You can't sort of push them away. You have to scoop them up. I mean, we are looking at masks that have cut out so it's where it's plastic and so they can see your expression. It's just it's another really.
Yeah.
And when I really
there's no right
look
answer.
at it on a sort of.
It's very scary. There's no right answer. You don't.
How it's going to be anything other than it always was, and that we're just going to be taking a big risk.
You're right. And so one of the things that may have to happen is, in situations like yours, is if it's possible, and it may not be,
that's kind of what
to limit the number of children that you have to deal with at a given time.
Everybody just has to.
Yeah. Again, it may not be economically feasible to reduce the number of children in the group.
Trying to figure out a schedule. We only have one big room.
Yeah. You're presenting it.
We're trying to come up with a schedule where maybe we have 10 outside and 10 inside, and then swap and. Very, very difficult. Yeah, and children don't believe in distancing, to say the least. And so the question would be, when you have children who are that demanding in that, in a group where you only have so many adults, the question is, what do you do? Do you try to limit the number of children? Do you sort of separate them so that you have a higher group, a smaller number of children that have those kind of needs, with more adults, and then you have the other children, a group where there are fewer adults, but maybe they're not such intense needs, but they're not interested in your problems. They are doing what they do, but protecting yourself is much more difficult in a situation like that. Much more difficult. One last quick question. In terms of like bathrooms, and I'm sorry I got in late, so if this was already covered, I apologize. But
no.
I'm
sorry, I didn't hear that.
You're going in and out, Jill. If you want to write down, you're coming in and out. Your service is a little drops off a little bit. If you want to type your question into the message box, if you can do that, we can get him to answer it. I think you were talking about bathrooms or something like that, but that's all we could hear.
Yeah, I didn't hear the rest either.
Yeah. Okay, well, I know you probably have to go. You have,
I have a patient waiting for me, actually.
Okay.
So
thank you so much.
Thank you.
Appreciate it, Dr.
I hope it was of some use, and
Thank you.
this was a
Thank you.
pleasure. Good luck, everybody, on this.
Thank you so much.
Thank
And
you.
hopefully they won't have to send kids your way.
Right.
Absolutely.
Bye, doctor. That's fantastic.
Robin, that was
great.
great.
It was great. It was really good.
Good.
What is his name?
His name is